Hi, this is Elizabeth Jones, and this is my neurological exam. Um, so, before I would begin my exam with a patient, I would wash my hands very well, of course. All right, Kevin, you understand that this is going to be posted on the internet. Do I have your consent to do that?
Yes.
Okay, all right, so we've obtained consent, so we can sort of start with everything. So first we're going to start with your olfactory nerve, which is cranial nerve 1. So what I'm going to have you do is close your eyes, and I'm going to occlude one of your nostrils, and I want you to take a deep breath, or deep sniff. Okay, what's that smell like to you?
Cheap coffee.
Oh, okay. All right. Sneeze or sniff again. Again. What do you smell?
Coffee.
Okay, perfect. That's exactly what it is. Coffee. Excuse me. So, moving on to cranial nerve 2, which is your optic nerve. We have a couple different tests for that. Excuse me. I'm going to walk you through the Snellen chart. And then we're actually going to take a look at some internal features of your eye. So if I can get you to just, there you go. That's about right. Okay. So what I'd like is for you to cover one eye. All right. And I want you to read the largest line that you can make out without straining.
LEFODPCT.
Perfect. Okay. So cover that other eye. And again, smallest line you could read.
There's a glare. LECPD. EOC. Whew.
Yeah, that was good.
Yeah.
So, so let's go ahead and get you to uncover both eyes and stay right there. And again, if you could read just the smallest.
FDPLTCEO.
You are 20.
Go move your
15.
hand. I want to see if I can read the bottom. Oh, there's too bad of a glare. PEDOLCFTD.
Absolutely.
Was that right?
Yeah, that's 2010. Very impressive. All right.
Well.
Okie dokie.
Wonder what I'm wearing glasses. Gee.
All right. Oh, Lord. So next we're going to take a look at your pupils. Oh, there it is. It finally worked. Okay, let me take my glasses off here. All right. So, right to right. All right. Everything looks good. No swelling. You have a sharp disc. Okay, great. You did perfect. I did want to mention, I did see something on your right eye.
Mm-hmm.
So I'm not an ophthalmologist, but we'll probably send a referral in for you to visit an eye doctor. All right. Okay. So next we're going to observe your ocular motor nerves. So that would include number 3, which is your ocular motor nerve. and it would include your optic nerve 6, which is the abducens, and also it includes optic nerve 4, which is transducens. So essentially what that means is for this particular part of the exam, we are not going to just assess what you can see straight on. We're going to assess for moving your eye up and down and just in different positions. Okay?
Mm-hmm.
Alrighty. So one of the things I'm looking at right now is your actual structure of your eye. We like to make sure that you don't have an eye drop. That's called ptosis. It's not terribly abnormal, but it's not something that you should have. So what I'm going to do is I want you just with your eyes. I want you to follow my finger, okay?
Mm-hmm.
All right. Okay, you did perfect. All right, I'll give you a second to let your eyes adjust.
Mm-hmm.
Okay, they're adjusted. So what I'm going to do is we're going to test your peripheral vision. And what I'm going to do is I'm going to start from right about your ears, and I want you to tell me as soon as you can see
Mm-hmm.
my finger, okay?
No.
Okay, all right. Is that your left or your right?
Both.
Both. Okay, all right, yeah, that's pretty good. Yeah, I would say that is pretty good. Let's see, let's get our ophthalmoscope out here again. All right, so what this test is going to do is it's going to check your pupil constriction and dilation. So I'm going to shine the light in one eye, and of course we expect that pupil is going to constrict. But what most people don't realize is that your other eye should constrict as well. Okay, so totally painless here. Just go ahead and look straight. Keep looking straight. All right, super. Okay, let's see what else we have. Oh, you know what? Let me just take a quick look again. Okay. So that was just measuring the size of your pupils. And so your pupils are a 3, which is normal. Alrighty. So cranial nerve 5 is our trigeminal nerve. So what I'm going to do is I'm going to place my hands on the side of your jaw, and I want you to open and close your jaw for me. Okay? Okay. Okay, move side to side. Okay. Can you jut your jaw out? Okay, and then yeah, that's good. All right. Okay, you did good. Part of cranial 5, the trigeminal, is testing for discrimination. So essentially what we're going to do is I'm going to touch you on 6 different areas of your face, and I want you to tell me if it's sharp or if it's dull. Okay? You want to go ahead and close your eyes for me?
Dull.
Okay.
Sharp.
Okay.
Sharp.
Mm-hmm.
Dull. Dull. Sharp.
Okay, fabulous. You did great. All right. So, let's see. So it was cranial nerve 5. We already talked about cranial nerve 6. That was the abductions, and that was one to check for laterally eye movement, and you did great with that. All right. So cranial nerve 7 is the facial nerve. Yeah. All right. So I want you to do a couple things for me. Okay. I want you to raise your eyebrows for me. Okay. Perfect. All right. So now what I want you to do is I want you to close your eyes really, really tight. Okay. Don't let me open them. Okay. You can go ahead and just open them back up now. All right. What I'd like you to do for me now is I'd like you to puff both your cheeks out for me. Okay, you did great. Okay. Let me get a smile. Okay, all right, perfect. Okay, working our way down. Cranial nerve 8. This is the vestibular cochlear nerve, and so with this nerve we're going to test your hearing. So there are multiple tests to do. Unfortunately I can only do one of them, but I'll walk you through the other two. So what I'm going to do is I'm going to stand behind you up to the side. I'm going to plug your ear. I'm going to whisper a word to you.
Mm-hmm.
And whisper it back to me.
Apple.
Okay. Here.
Baseball.
Okay. Perfect. All right. So the other two tests require a piece of equipment called a tuning fork. Unfortunately, mine has not arrived yet. But essentially, what we would do. There are two tests. It's called a Weber test and a Rhine test. So essentially, with the Weber test, what we would do is we would strike it, and then we would place it on the top of your head, and we would ask you to let us know when it's done vibrating, when you can no longer hear it. The second test, the time test, again, we use a tuning fork. We strike it against our arm here. And what we do is we place it back here on your mastoid bone. And then when it's done vibrating, you tell us, and then we place it right in front of your ear. So these are tests to help for, these tests help determine if you have centroneural damage, as well as a couple other things. All right, so cranial nerves 9 and 10. This is the glossopharyngeal and the tragus. Tragus is, vagus. That is actually cranial nerve 10. So what we're going to do with this is I'm going to have you open up your eyes for me. I'm sorry, did I say your eyes? I didn't mean your eyes. I'm going to have you open up your mouth for me, and I'm going to take a look at your uvula, which is that little thing that hangs down the back of your throat, okay? Say ah. Okay, great. So what we're checking your uvula for is making sure that it's midline, and yours was. So that's what we expected. All right. Cranial nerve 11 is the spinal accessory test. So if any of these tests are feeling a little bit familiar, I know that we did some earlier, but if you ever end up hopefully never needing a stroke assessment, this is very similar to a stroke assessment. So what I want you to do is I want you to shrug your shoulders for me, okay? Shrug them again. Okay, right, that's good. All right. So now we're just checking your trapezius. Okay. Shrug again for me. Okay. All right. Perfect. All right. So next, I'm going to ask you to turn your head from left to right. Oh, I'm sorry. I'm going to apply some pressure. Go ahead and turn. Okay. Now to the other side. Okay. All right. So, so that was that. And the last is the hypoglossal nerve, cranial nerve 12. So let me get you to stick your tongue out, move it side to side. Okay, move it up. Okay, all right, perfect, perfect. So, so we are done with your cranial nerves. All right, so let's see, let me get my fork here. So we're going to move into testing your DTR's deep tendon response. So we're going to do it on the on your tricep back here. Yep, we'll get to that in just a minute. Okay. And then we are going to check it your brachioradialis, and then we'll go ahead and we'll do your popliteal. Do you have any injuries that I need to know about before we start?
No.
Okay. All right. So, nope. I'm going to hold this. Just let it relax. Go loosey-goosey.
You hit it once.
I know I did. I was just trying to make it pop again. Okay. Nope, you're good. Let's come over and try this on. Okay. All right.
Wow.
Alrighty, so let's go ahead and check down here. Okay. Now the left leg. Okay. All right. Perfect. Very good. Okay, so what I would like you to do now is I'm going to have you, I'm sorry, I keep asking you to stand up and sit down. What I want you to do is just walk normally to the door there. Okay, perfect. You can come on back now. All right. Before you start, I want you to walk on your tiptoes for me. Okay, all right. So now turn around and I want you to walk on your heels. Okay, perfect. You can come on in. Okay, before you sit down, I want you to go ahead and stand with your feet together. All right. I want you to put your arms out front. Okay. Palms up and close your eyes. Okay, you can go ahead and open your eyes, keep your arms up. Okay, all right, you can go ahead and just put your arms back down. You're good. Yeah, you're good. Yeah, for our next test here. So what I'm going to have you do now is I want you to go ahead and squeeze my two fingers as hard as you can. Okay, perfect. All right, so go ahead and bend your arms up here. All right. I'm going to pull towards me. I want you to resist me. Okay, all right. Turn your hands over for me. I'm going to push them back. I want you to resist. Okay. All right. Okay, that was good. You can go ahead and put your hands down. Let me get you to spread your fingers out for me. Okay, and I want you to go ahead and pull them back in. Adduction and abduct. Okay, very good. So with your shoe or with your sock, whatever's comfortable for you, I want you to take your right heel, and I want you to rub it up and down the shin of your left leg. Okay, perfect. All right. Now, can I get you to do the same thing? Okay, perfect. Perfect. Let's just see. I don't want to miss anything here. All right. What I want you to do is use with your feet, or just one. I want you to flex your foot and then dorsiflex it, point it all the way down. Okay? Great. And let's go ahead and do it with the other. Okay? Perfect. Perfect. You're doing a great job. Yeah, so I think that we've covered everything. I appreciate you coming in, and we'll see what we can do about helping you get rid of that headache.
Thank you.
You're welcome. Thanks for coming in.